Hi, welcome to Poola Met. Have been recently asked a question on how to prepare for MD final theory examination. Since you have just few months left, yes, this is the video for you. Let's go to the answer without any further ado. Now, is this advice really for you? I say yes because you have exams in few months. Even though you are among those people who do not have exams in few months, just joined your first year or in your second year, then also you should consider this video because it will let you know how to prepare for the exam, because anyway you are supposed to give it at the end of your course. Third thing, if you are aspiring to be an MD degree holder, then also it is a video for you because you can plan much ahead. Especially you can have the grasp of the subject in your initial learning stages of MBBS. Why take advice from me? One thing is, I am an MD degree holder, so I already achieved the goal which you are aspiring to achieve. Second thing, I am a teach faculty. My advice might be of a great help to you, and I really wish that it helps you. So, where we are supposed to start initially for the preparation is, you need to know one thing, that is what is inevitable, and then you have to motivate your brain and make it understand that you have to go through all this. One is, there is no escape. Since you have joined the course, since you are having few months for the exam, you do not have any escape. You are supposed to complete the course and then get your degree. Second thing is, there is no other alternative for you. Once you get into this, you can't go out. Even if you do have an alternative, it's much riskier. Third thing, you need to put effort, and it's supposed to be very much persistent, because nothing comes for free. So you have to put some effort. And next is patience. This is really important because the seeds are not sown now, and even if you sow them, they won't reap you fruits tomorrow. So patience is very much needed for you to get into this as well as clear this. So you have to have some patience. Next is stress, whatever you are feeling now or which you might feel in near future. It is very much normal. It is a passing cloud. You don't let it overwhelm you. The stress should be productive. It should make you study. It should not trouble you or prevent you from studying. Finally, emotion. This is very big weapon because the journey which you are going to go through is alone. No one is going to be part of the journey, neither me nor anyone else. It's your own race. So you have to walk, you have to run. So in this journey, you will come across several situations where your mental status is put to test. So when it is like that, you are supposed to defend yourself. Do not let the emotions be counterproductive. So first step of preparation is getting your mindset right. Second step is what you actually need. First thing is the idea on what you are supposed to study. That is very much important because it forms the base on what you have to know. So for me, I have done 10-year previous year papers of my university and 5-year previous year papers of a neighboring university. And order of importance is very important because it is by name order of importance. So first thing is most repeated to least repeated. So even in among the most repeated, 15 times repeated is likely to come than 5 times repeated. So you have to have that order in your hand and you have to prepare it that way. Some people tend to prepare it system wise, suggest you do it paper wise because that is better than system wise, because it's likely you will cover everything and you do not miss anything. Next thing is, you should have a notebook which will mimic your answer sheet. Like for example, in my university, the answer sheet, each side is 25 lines ruled. So it's better I have a rule notes, and then I write my notes in that rule book so that future it is helpful in revision. Next thing is source of study. Stick to one source. Different people study different things. For example, I studied from Braunwald cardiology and Pihali nephrology and Kelly rheumatology. So it doesn't matter. Though I studied so many different books, still the answer I give will be limited to what comes to my mind at that point of time based on what I have acquired over past 3 years. So it doesn't matter. Source doesn't matter really. Go with what feels comfortable to you and stick to it. Don't get overwhelmed by other people, what they're studying and all. It's none of our business. Next thing is you need to have a distraction free environment. You have a phone beside you and it continuously gives notifications and you end up looking into it, not preparing. Then it's not going to work that way. Distractions you should avoid as much as possible, and then you have to concentrate on your studies. So this is what needed. So next comes is time factor. What are these few months? I have been telling few months, and let me tell you, few months for me is not few months for you. It could be many months for you because I know that I read from several books, so it's a time taking process. For me, few months were like 10 months. I started my preparation in December 2024. I gave my exams on October 2025, so it's roughly 10 months. And when to start? Right now. Right now is the time to start. After the video is over, just open your books and start studying because the tomorrow or day after tomorrow you talk about that never comes. Next is how many hours per day. It doesn't really matter as long as the number of hours you are doing per day isn't exhausting you or making you take a off tomorrow, then it doesn't matter. You can study as much as you can, but only thing is ensure that it won't cause you mental fatigue. You have to study every day, that is like a rule. Next is revisions. Revisions, I suggest you do at least two revisions because what I have done is I have in the 10 months time I had, within 7 months I completed my portion, and 2 months I have done one revision, and then the last month I have done another revision, and weeks before exams I have continued to study at my own pace. Next comes is notes. Now notes is very important because one cannot revise a textbook. So how the notes supposed to be? One, it should be legible. You should understand what you have written. Second thing is it should be concise. Rewriting a textbook and saying it's a notes is like a foolish thing. So make it concise, and then it should mirror what you are going to write in your final paper. So that is very important, and it should also contain mnemonics that are going to help you with memory. Then it should be revisable. So I will share a few snippets of how I tend to write. So if you see here, I have just mentioned the classification of atrial fibrillation. This entire table, I think it can be written in some 15 or rather say 18 lines. So it almost fills more than half of the page. So this is really very much important that you ensure your notes is concise enough but still have the potential to expand and fill the page. So that is one thing you should know. Second thing is less matter, more diagrammatic representation. Even if for that matters, you can make flow charts. So that is also very much important. The notes containing diagrams, flow charts, tables, so that you generally what you read during the revision, you just put that in your final exam. So if you could make a good notes, you will make a good final exam paper. So that is also very much important. So having said all this, I just really wish you this helps you and guides you on how to prepare for your MD final exam. So the steps being motivating yourself, then ensuring that you have all the contents what you are supposed to study, making sure you study in right place, and taking time factor into consideration, writing on your own legible notes in a very systematic way so that it can be revised in your future. So all the best. See you again in another video. Do comment on what more videos you would like to have, and subscribe for my channel. Thank you very much. Really,